Welcome to the core. My name is Don Diamond. I'm the Executive Director of Clinical Operations here, and what we're going to talk about today is our manual muscle testing method. Now, first thing I want to say is welcome to the team. It's great to have you on board, and we always look forward to bringing on quality clinicians. So, the first thing the biggest difference we make when we're working with our clients is this handheld dynamometer. When we truly get in and assess our patient's strength, I feel like we need to use something truly objective. Because right now, the scale of 0 to 5 doesn't cut it. If I could say it's a 5 out of 5, someone else could say it's a 3+ out of 5. That just isn't objective at all. So what I want to do is throughout the clinic is to make sure we have these objective measurements. So the tool we use, this handheld dynamometer, allows us to measure that in peak force. So if we look here, you're going to turn on the device and you're going to hit the reset button. And then what happens is that it's going to show in duration seconds, it's going to have an H and a 0. You always want to make sure that's not an H. If you hit this orange threshold button here, that will go to L and toggle back to H. You always want an H. H hits the highest threshold as far as the peak force. L will actually give you the lowest threshold of force that they generate. And then here is the reading that you have right here. So as you push on this, you can see here there's a reading of 60.4. That's 60.4 pounds peak force. And what it does is it measures the actual peak force. So at one time peak force, the highest point. And then what you do is you take that measurement 3 times, and then the average of that is what your actual manual muscle testing force is. So Eric here is going to be our model. So I'm going to demonstrate the test on him. So the first thing to keep in mind when you're doing these tests is these tests are break tests and not make tests. The difference is that, go ahead, make a fist here for me, please. Hold that. So a make test, I would just have Eric push against me. So go ahead and push, 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 push. And then there, I ended up getting a reading of about, let's say, 32. Now go ahead and hold that and only push it. Push, 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 push. And there I get a reading of 50. So a make test is more of an isometric contraction, where a break test is actually an eccentric action. So the muscle's actually working while it's lengthening. All of our manual muscle tests are break tests. It's more of how the muscle tends to function. We get with most of our higher level patients, we're getting a higher level reading. We're going to know where they need to be. So the upper extremity, which we're going to start with, go ahead and lay on your stomach for me. So with the upper extremity, I'm taking you through the tests that I do in the order that I do them. So when we first start off with the upper extremity, usually it's after the patient has already gone through some of the mobility testing. They've been on their back, they've gone through the shoulder, we looked at the posterior capsule. Now I lay the patient on their stomach, and now I'm going to do the manual muscle testing. The first one we're going to look at is the mid-trap. So the mid-trap, 90 degrees of abduction, elbow straight, thumb up, that's very important. And then the hand is actually holding onto the table here. So you're going to hold this position, and then I'm going to go ahead and push down. So push, 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 and rest. As soon as his upper arm hits my hand right here, that's when the test is over. That way I won't have him push down against the table and get a falsified high number. Now, something to keep in mind when you're doing this, for the upper extremity, the majority of the time that you measure, it's going to be pushing on the wrist. So majority of these tests, you're pushing on the wrist. This cradle fits in nicely at that point. The other thing to keep in mind is that you're doing a break test, not a make test. Break test, you're holding position, you're pushing through the range, that's an eccentric action for the muscle, versus a make test, hold that position for me and just push against me. Push, 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 push. And now that's like almost as if I'm a table leg, it's just pushing against me. That's an isometric. We want eccentric loading through the break test. So you're pushing through the range. This will tell you what the peak force was going through that range. So that was mid-trap. And I bend their elbow at 90 degrees. This one is going through the elbow. So now I'm going to push down and forward. Push, 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 push. And again, my hand is right underneath the bicep, so as soon as it hits that, the test is over. And as you're pushing at 45 degrees, that gets the fibers of the lower trap right here. Now we're going to go on to the teres major. So go ahead and put your hand underneath your hip here for me, Eric. So when we're doing the teres major, I'm actually pushing pressure through here. Now according to Kendall, the hand should be up here, but the majority of our patients have shoulder dysfunction, most often restricted internal rotation, so I just put it under here, and this is what we do consistently in the core. Hold this up here for me and only push you down. Push, 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 push. And as soon as their hand hits my hand, as soon as their elbow hits my hand right here, test is over. The lats, now with the lats, we're going to get in this position right here. And then I'm going to push down and away. So go ahead and push down and away. Push, 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 resist, 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 resist. Good, that's for the lats. Now we're going to get into the rhomboids. So with the rhomboids, we're going to lift this up here, hold that, do not let pushing down. Resist, 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 resist. Good, I'm pulling right on the scapular border. Getting those rhomboids, I'm pulling forward a little bit. That's going to help to basically test the strength here, but this one's going to be on a 0 to 5 because I can't really put the handheld dynamometer here and get a good read. And then the other one we have is the teres minor, which is in this position here. So with the teres minor, I'm going to be here, and only push you down, push, 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 push. Good, I'm supporting the elbow here, I'm pushing down through the wrist here, and then that's giving my reading for the teres minor. So again, to review these real quick, mid-trap, out to the side, I'm going to push down. As soon as it hits the hand here, it's over. Low traps right here, pushing down and forward. Teres majors right here, I'm pushing down this way. And then lat is straight, pushing down and away. Rhomboids right here, up, don't let pull you down. That's the rhomboids right there. All right, so now we're going to look at the lower extremities in the prone position. So the main ones I look here is hip internal and external rotation, hip extension, and hamstring flexion. So when you're looking at this, you want to make sure the patient doesn't move here, that they keep their butt down. That's one of the main cues I give them. When we're looking at hip extension, we want to make sure that the leg doesn't internally or externally rotate. We want to keep it up into this neutral position. Go ahead and hold that for me. I'll ask the patient to hold it. I'll take the handheld dynamometer, get as close to the knee as I can. Go ahead and do not let me push you down. Push, 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 push. And as soon as the knee hits my hand, test is over. And then I look at the measurements. Now for hip internal rotation, I bring them into this internal rotation just a little bit here. I'm going to have them hold here. I'm going to say resist me. I take my other hand, place it on the knee here to give them a block so they don't try to cave that in at all. And go ahead and do not let me push you in. Push, 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 push. Good, and that looks at resisted internal rotation strength. As soon as they get to about 15, 20 degrees of external rotation, that's when the test is over. And then I look at the number. Same thing with external rotation. Here in this position, and the majority of these lower extremity tests are all done putting pressure through the ankle. Unless they have a knee injury, obviously you don't want to do this with an acute knee injury. You're going to look at that later. If you want to measure hip abduction strength, then you can take this and place it proximal to the knee. But I'm going to hold this here, do not only push you down. Again, the fist is over here, don't only pull you away. Hold, 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 hold. Good. And now that's looking at resisted external rotation. As soon as they get to about that 20 degrees of internal rotation, the test is over for resisted external rotation. Now for the hamstring, we're going to look here just about the musculotendinous junction right here. This is where you're going to place the handheld dynamometer. You ask them to hold, go ahead and hold. Don't let push you down. Push, 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 push. And at that point there, you're going to get their reading. Now it's important that when you're pushing, that you actually push slow through all of these tests. You don't want to get into where you're jerking it because that creates an impulse and you can kick in the reflex and that'll give you a higher reading than what you actually should have. So that's the lower extremity in this position. All right, so now we're going to look at the posterior fibers of the glute medius, hip abduction. So what you want to make sure is you take the patient's leg, you straighten it out. You roll the hip forward slightly, you bring the leg back into slight extension. The foot is pretty much pointed straight ahead. You don't really want to turn internally or externally. It's held in a neutral position. First thing you can do is you can bring them up to the back like this, and then you just want to see if they can hold it. So go ahead and hold that position for me. There's a little bit of a drop there, which shows me there's some weakness, so I'm now going to test that. Hold this here for me, and do not let it push you down. You push, 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 and you can see a lot of patients will try to bring the leg forward and the hip back. That's not what you want. You want to make sure they keep the leg back here, so keep the leg back here, Eric. Don't let it move. Keep that knee straight. Don't let it push you down. Push, 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 push. And I bring them just to about midline of the body right here. And then the test is over. And then I get the rating. His was actually 13, which is really pathetic. All right, over to the other.
And you can go backwards.
Okay. All right, so the other one we want to look at in this position is a hip adduction. So you're going to place the leg up here. You're going to take the bottom leg, make sure the knee's straight, lined up in midline. Foot points straight ahead, so not internally or externally rotated. You're going to bring your leg up here like this, have them hold it, and then with the ankle you push down. Go ahead and push, 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 resist. And as soon as this hits my fingers, test is over. He's actually at 28, which is more than twice what he has on his hip abductor. So again, that's not a healthy ratio. So here we're going to look at the upper extremities. We're going to look at the shoulder specifically in the sitting position. So we've already done the one laying down in prone. So we've gotten all that mid-trap, low-trap, teres major, rhomboids, lats, teres minor. So now we're going to get in, we'll look at the infraspinatus, supraspinatus, radius anterior, subscapularis. We're also throwing some biceps and triceps. So the first thing we want to do in the seated position when we're doing this is that their feet can actually touch the ground. So we're going to lower this table down so his feet are touching the ground. That way he has some support. It's not limited by his stability. And we get him in a position where his posture is good. He's going to make a fist with the hand here. Hold that position right there. So we're going into 45 degrees of internal rotation. This is going to look at the infraspinatus. You're going to hold that position. And then what you do is you go ahead and you push in. Go ahead and push out. Push, 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 push. Good. And then that's where I get the reading. Now, a lot of times patients will try to push out with the abductors. They'll also try to straighten the arm out a little bit. So this has to stay bent at 90 degrees, and you're just pushing straight into here. Just before it hits the stomach, that's when you want to let up, so you have to make sure you pay attention to that. So that's the infraspinatus. Supraspinatus, position of scaption. So we go 45 degrees anterior to the frontal plane. And then in this position here, I like to do a full can versus empty can. Full can puts them in less pain. You still get a good reading on what the supraspinatus can actually do, but you're not causing them pain or impingement by going into the empty can. Hold this position for me. So again on the wrist, do not only push you down, push up, push, 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 push. Good, and that's the supraspinatus. Now we're also going to look at serratus anterior. So serratus anterior, we bring them up to about 120 degrees, position of scaption again. That's going to look at these fibers here, the serratus anterior. Place the hand up here and do not only push you down. Push up, push, 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 push. Good, and then you get the reading. It's a small motion through here, and a lot of times you'll see your patients kick in the upper trap because obviously that's a force couple that works with that serratus anterior. The other one we're going to look at is we're going to look at the subscapularis. I'm going to do it on the other arm here so you can actually see what it looks like. So you're going to bring your hand off the back here, elbow stays bent, and they're going to hold that position. So go ahead and hold that position for me, and then do not let me push you in. Push, 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 push. Good. Make sure you hold it off the back and you do not straighten your elbow at all, so don't straighten your elbow. Go ahead and hold that position for me. Hold it, hold it, hold it, hold it off your back, hold it off your back. Don't push you forward, push, 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 push. Good. And I place my hand in between, so as soon as it touches, test is over. Okay, and then we're going to look at the biceps, so go ahead and make a fist for me here. Hold that here, and don't let me push you down, so I'll just push down, push, 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 push. Good. That gives me the biceps. Now look at the triceps, so hold that position here. I come underneath the wrist, I can stabilize up here and don't let me push you up. Push, 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 push. Good. You can try to break them at that point. If you have a hard time breaking them at that point, you can use both hands. Go ahead and hold this position, push down, push, 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 and then you get them up into that position. The other thing we look at in this position is we look at quad strength and hip flexor strength. So I'm going to lift him up a little bit, get his feet off. He's going to take his hands, hold on to the back of the table, keep this leg bent at 90 and lift it up. So up, hold that right there, stay straight up through here, here. Try to keep this in neutral so it's not going in internal external rotation. Place your hand underneath on the table and don't let me push you down. Push, 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 push. As soon as you feel the hamstring hit the hand, test is over. And then for the quad, we'll go ahead and take them straight, bend your knees slightly, hold that position, and don't let me push you down. Push, 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 push. And I can barely break him, so he has one good thing going for him. So that's how you look at the quad. All right. Now, if you have a hard time getting in and breaking some of these patients as far as manual muscle testing going, then that's one of your colleagues that can help you out. There's a number of therapists that have a hard time getting this one because you have to generate a lot of force. So ask one of your other colleagues that may be a little bit bigger that can go in and push that down. And that's it for this position. So this next one, we're going to look at, this is how we test ankle strength. So first thing you're going to do is have your patient remove their shoes. Go ahead and remove one of your shoes for me, please. We'll do this one. And then obviously you want to make sure the table's at a comfortable height for you. So go ahead and lay on your back for me. Make sure the feet are hanging off the edge. Come down here just a little bit more. So we want to do dorsiflexion. We're going to test here. Neutral position. You put this cradle right along the mat heads, and you go ahead and ask them to hold. Don't let me move you, and you can hold on the table if you feel like you need to. Hold, 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 and you come down until there's a break. and that's your reading. Now for inversion, you bring them in, you hold them in that position, right along the first mat head, hold, you stabilize over here, and do not let me push you out. Push, 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 push. So there's no rotation that should take place here. It should be strict just him using his inverters to keep the foot in this position. Now for eversion, same thing. You bring him out here, you bring it out to the fifth mat head, and then you hold this position here and don't let me push you in, hold it out. Hold, 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 and then you push him in that position. That's how we look at inversion, eversion, and dorsiflexion. For looking at the strength of the plantar flexors, go ahead and stand up for me, please. I'm going to say you stand right here. Go ahead and lift up your right foot. Put your hands out like this. Hold on top of my hands. Now go ahead and do 20 raises. 20 calf raises. Yep. So any athletic person should be able to do 20 calf raises, no problem. This is just for balance. And you take them through. If they start to fatigue, that's when you mark them down, and that's the amount of reps that they've done. And relax. Okay, good. So now we've gone over the manual muscle testing we use here at the core. So a couple things to review. One is that it's a break test, not a make test. You want to make sure when you're testing the upper extremities that you're doing it through the wrist. The lower extremities, you're doing it through the ankle most of the time. Obviously, if there's a knee injury, then you're going to be proximal to the knee when you're dealing with the lower extremities. You want to take 3 measurements, ideally if you can. Sometimes in no timing you won't. So if the two measurements are close together, you can just use the average of that. A couple things for you to know, like we usually like to see the infraspinatus strength be 25% of the overall body weight of that patient. So if that patient weighs 200 pounds, we want that infraspinatus peak force to be about 50 pounds. Subscapularis, we'd like to see that around 15% of their total body weight. So again, if they're 200 pounds, we would like to see around 30 pounds of peak force that they can generate here. Internal rotators and external rotators, the strength we like to see there for females is in the 30s. For males, it's in the 40s. For hip abductors, we'd like to see that in the low 30s for females at least, and then in the upper 30s to low 40s for males. That's pretty much it. And then if you have any questions, concerns, anything you'd like to add, anything you'd like to discuss, feel free to talk to any mentors in the clinic. You can speak to your clinic directors. We're here to help. We want to make you a successful therapist, a successful part of the team. So again, welcome to the core, and we look forward to working with you.